Dr. Kate Morrison wiped the sweat from her forehead as she walked through the long metal halls of the New Horizon research ship. The ship was huge and filled with beings from many different worlds. Kate was one of only 12 humans on board, while the rest of the crew came from 4 different alien races. She had been working as the human medical officer for 6 months now and still felt amazed every day when she saw her alien friends. The ship moved slowly through space toward the Sigma 7 asteroid belt where they would collect rare metals for research. Kate liked her job but sometimes felt lonely being so far from Earth. The other humans on the ship were nice, but they all had their own work to do. She spent most of her time with Commander Vexstar, who looked like a giant, walking stick bug with 4 arms and green skin that changed colors when he was upset. Kate walked into the medical bay where she found Science Officer Nith reading reports on his tablet. Nith was from the Aquari race and looked like a tall blue frog that could walk on 2 legs. His skin was always wet and he had to wear a special suit that kept water flowing over his body. He made soft bubbling sounds when he talked, which Kate found peaceful. "Good morning, Nith," Kate said as she checked the medical supplies. "How are the mining preparations going?" Nith looked up and his big round eyes blinked slowly. "The Krethak workers have been checking all the equipment for 3 days now. They want to make sure everything follows the safety rules exactly. Commander Vexstar says we will start mining tomorrow if all the forms are filled out correctly." Kate nodded and smiled. The alien races were very careful about following rules and procedures. Everything had to be documented and approved by committees before anyone could do anything. It was very different from how humans worked, but Kate had learned to accept their ways. She sometimes missed the quick decisions that humans made, but the aliens had kept their civilizations safe for thousands of years with their careful methods. The ship's communication system made a loud, beeping sound and Commander Vexstar's voice filled the room. "All crew members report to stations. We have arrived at Sigma 7 and will begin mining operations in 2 hours. Medical teams prepare for standard deployment procedures." Kate and Nith began getting their equipment ready. The aliens had very advanced medical tools that could scan and heal most injuries without anyone having to touch the patient. Kate carried her human medical kit too, but the aliens thought her tools were very primitive. They did not understand why humans would want to touch sick or injured people with their hands. 2 hours later, Kate stood in the mining control room watching screens that showed the mining operation. Ryan Blake and 3 other humans worked alongside Krethak miners in the asteroid tunnels. The Krethak looked like large beetles that walked upright and had very strong bodies perfect for heavy work. Their leader was a worker named Zekth, who had been mining asteroids for 20 years. The work went smoothly for the first hour. The teams used large machines to cut into the asteroid and extract the valuable metals. Kate watched Ryan operating a drilling machine while Zekth directed other workers with hand signals. Everything looked normal and safe according to all the monitoring equipment. Then the alarm started screaming. Kate saw the mining tunnel shake on the screen and dust filled the air. The support beam that held up the tunnel ceiling began to crack and bend. She heard Ryan shouting through the radio, but his words were hard to understand through all the noise and static. "Emergency." In Tunnel 7 came the clear voice of Aquari Technician Glubnos through the communication system. "Support structure failing. Multiple crew members trapped." Kate grabbed her medical kit and ran toward the transport shuttles while Commander Vexstar began calling for emergency response teams. The alien procedures required him to contact the medical specialist from each homeworld and wait for proper authorization before sending help. Kate knew this process usually took at least 30 minutes. The shuttle ride to the mining site took only 5 minutes, but it felt like hours to Kate. She could hear radio reports that the tunnel had collapsed and several crew members were hurt badly. When they arrived at the mining site, Kate could see the entrance to Tunnel 7 was blocked with rocks and twisted metal. Ryan Blake lay on the ground outside the tunnel entrance. His left leg was crushed under a heavy piece of metal beam and blood covered his worksuit. Zekth sat against a rock wall with one of his forearms completely severed and green fluid leaking from the wound. Glubnos was conscious but breathing badly, and Kate could tell he had internal injuries from the way he held his body. Commander Vexstar immediately began setting up the official emergency response station. He called for medical scanners and began documenting the injuries while waiting for the specialist teams to arrive. Other alien crew members helped by taking photographs and filling out incident reports. Kate stared at the injured beings and felt her heart racing. She knew that following proper procedures meant Ryan, Zekth, and Glubnos would be dead long before any help arrived. The human part of her brain screamed that she needed to act now to save their lives, but the aliens had made it very clear that touching patients without proper authorization could result in serious criminal charges and contamination of the victims. Kate stood frozen between her human instincts and alien law, while 3 beings slowly died in front of her eyes. Kate Morrison watched Ryan Blake's blood spreading across the rocky ground and felt something snap inside her mind. She had sworn an oath to help injured people, and no alien law was going to stop her from saving lives. She dropped her official medical scanner and grabbed her human first aid kit instead. Dr. Morrison, stop. Commander Vextar called out as Kate ran toward Ryan. You must wait for proper medical authorization and contamination clearance protocols. Kate ignored him and knelt beside Ryan, who was unconscious and losing blood fast. She pulled a knife from her belt and cut away his torn pant leg to see the injury better. The metal beam had crushed his shin bone and torn open the skin, but had missed the major blood vessels. Kate knew she could save his leg if she acted quickly. She grabbed a clean shirt from her pack and pressed it hard against the bleeding wound. Ryan groaned and opened his eyes when she applied pressure. Kate looked into his confused face and spoke in a calm voice, even though her heart was beating fast. Ryan, you are going to be okay, but I need you to stay still while I fix your leg, she said while maintaining pressure on the wound. Can you feel your toes? Ryan tried to move his foot and nodded weakly.
Kate felt relief because it meant the nerves were not completely damaged.
She used her belt to make a tourniquet above the injury and tightened it until the bleeding slowed down. Then she found 2 straight pieces of metal and used them with cloth strips to make a splint for his broken leg. Commander Vextar and the other aliens watched in shock as Kate worked with her bare hands. In their cultures, medical personnel never touched patients directly because it could spread diseases or cause legal problems. They believed that only machines should make contact with injured bodies. This is barbaric, Science Officer Neath whispered to the other aliens. She is contaminating the human with her body fluids and bacteria. Kate heard them talking but focused on Zeketh, who was losing green blood from his severed arm. She had never treated a Krethak before, but blood loss was blood loss regardless of what color it was. She ran to Zeketh and examined the injury while he looked at her with his large compound eyes. The arm had been cut off cleanly just below the shoulder joint. Kate could see that Krethak blood was thicker than human blood, but it was still flowing out too fast. She grabbed another clean cloth and pressed it directly against the wound while Zeketh made clicking sounds that she thought meant he was in pain. I am sorry this hurts, but I have to stop the bleeding, Kate said as she applied pressure. She used a strip of cloth to tie a pressure bandage around the wound and elevated Zeketh's body, so the injured area was higher than his heart. Security officer Jake Patterson had arrived with the second shuttle and saw Kate working on the aliens. Jake was a big man with short brown hair, who had been a paramedic before joining the space program. He understood immediately what Kate was doing and came to help without being asked. What do you need? Jake asked as he knelt beside Kate. Help me with Glubnos, Kate said, pointing to the Aquari who was breathing badly. I think he has internal bleeding and maybe a collapsed lung. Jake and Kate moved to Glubnos, who was sitting against a rock and making wet, gasping sounds. His blue skin had turned a pale gray color and Kate could see he was going into shock. She listened to his chest with her stethoscope and heard that one lung was not working properly. Commander Vextar tried again to stop them. Dr. Morrison, you are violating 17 different medical protocols. The Aquari physiology is completely different from humans. You could kill him with incorrect treatment. Kate looked up at the commander with angry eyes. He is dying right now while we stand here talking. I would rather try to save him and fail than do nothing and watch him die. She turned back to Glubnos and saw that his breathing was getting worse. Kate had learned about Aquari anatomy in medical school and knew their lungs worked differently than human lungs, but the basic principles were the same. She needed to help him breathe and treat the shock from blood loss. Kate positioned Glubnos so his head was lower than his body to help blood flow to his brain. She used her jacket to keep him warm and gave him small sips of water to help maintain his body fluids. When his breathing became very weak, Kate made a difficult decision. She tilted Glubnos's head back and gave him mouth-to-mouth resuscitation. The aliens gasped in horror as Kate put her lips on the Aquari's mouth and breathed air into his lungs. In their cultures, this kind of direct contact was considered disgusting and dangerous, but it worked. Glubnos's breathing improved and his skin color began to return to normal blue. Kate continued rescue breathing while Jake monitored his pulse and kept him warm. "I cannot believe what I am seeing," whispered Dr. Thiss, a Zephyrian medical officer who had arrived with the emergency team. "The human is exchanging bodily fluids with the patient. This should kill them both." Kate ignored the comments and continued working. She checked Ryan's splint and tourniquet to make sure they were still tight. She examined Zeketh's bandage and saw that the bleeding had stopped completely. She monitored Glubnos's breathing and pulse while Jake helped keep all 3 patients warm and comfortable. The alien medical teams finally arrived with their advanced scanning, equipment and sterile treatment pods. They expected to find 3 dead crew members, but instead found 3 stable patients who were conscious and talking. The alien doctors could not understand how the primitive human methods had kept the patients alive. Kate's hands were covered with blood of 3 different colors and her clothes were dirty and torn. She was exhausted from 30 minutes of constant work, but felt proud that she had saved 3 lives. The aliens looked at her like she was either a hero or a dangerous criminal, and Kate was not sure which one they would decide she was. The alien medical teams worked quickly to scan the 3 injured crew members with their advanced equipment. Dr. Thiss ran her scanner over Ryan Blake's injured leg and looked confused at the readings. According to her instruments, Ryan should have bled to death from his injuries, but instead his vital signs were stable and strong. "How is this possible?" Dr. Thiss asked Commander Vextar while pointing at Ryan. "The human has a crushed bone and severe tissue damage, but his blood pressure and heart rate are normal. The primitive bandages should not have been effective enough to prevent shock." Commander Vextar looked at Kate, who was sitting on a rock nearby, cleaning the blood from her hands. Dr. Morrison used direct pressure and elevation techniques that our medical databases say are unreliable and dangerous. Dr. Thiss examined the makeshift splint that Kate had constructed from metal scraps and cloth strips. The design was simple, but it held Ryan's broken leg perfectly still and prevented further damage to the injury. She had never seen such basic materials used so effectively. Meanwhile, other alien doctors were scanning Zekth and expressing amazement at their findings. The Krethak's severed arm had stopped bleeding completely, and his body was producing new blood cells at a normal rate. This should have been impossible according to everything they knew about Krethak physiology. The pressure bandage technique created perfect compression around the wound site, Dr. Vorth, a Krethak medical specialist, explained to his colleagues. "Our medical protocols recommend immediate surgical repair using nanotechnology, but the human method achieved the same result with cloth and pressure." Zeketh was conscious and talking to his rescuers in the clicking language of his people. He kept pointing at Kate and making sounds that the translation computer said meant grateful and lifesaver. The other Krethak workers gathered around him and touched his uninjured arms in their traditional greeting of respect, but the most dramatic moment came when the medical team was preparing Glubnos for transport to the ship's medical bay. The Aquari had been stable since Kate's treatment, but suddenly his breathing stopped and his heart quit beating. The alien doctors immediately began debating which specialist to contact from their home world for advice. Kate saw Glubnos collapse and ran to his side without thinking about protocols or procedures. She checked his pulse and found nothing. His blue skin was turning gray again, and she knew he only had minutes before brain damage would occur. "Stand back," Kate shouted at the alien doctors who were still discussing treatment options. She positioned Glubnos on his back and tilted his head to open his airway. Kate placed her hands on Glubnos's chest and began pushing hard and fast in the rhythm she had learned in medical school. The Aquari doctors watched in horror as Kate performed chest compressions on their colleague. They believed that such violent pressure would crush his internal organs and kill him instantly. "Stop her," Dr. Zolth, the head Aquari medical officer, commanded. "She is going to destroy his cardiac system with that brutal technique." But Commander Vextar held up one of his 4 hands to stop the other doctors from interfering. He wanted to see what would happen, even though he believed Kate was probably making a terrible mistake. Kate continued chest compressions for 2 minutes, then gave Glubnos 2 rescue breaths. She could feel his ribs bending under the pressure of her hands, but she knew that broken ribs would heal, while a dead Aquari would not. She counted compressions out loud while Jake Patterson timed the cycles. 1, 2, 3, 4, 5, Kate counted as she pushed on Glubnos's chest. Sweat dripped from her face onto his blue skin, but she did not stop. After 5 minutes of continuous CPR, Kate was getting tired, but she refused to give up. Jake took over the chest compressions while Kate continued rescue breathing. The alien doctors watched in amazement as the two humans worked together without talking, each knowing exactly what the other would do next. Their teamwork was smooth and efficient in a way that the aliens had never seen before. After 8 minutes of CPR, Glubnos suddenly gasped and his eyes opened. He coughed up some fluid and began breathing on his own again. His heart started beating strongly and his skin color returned to healthy blue. The Aquari medical officers stood with their mouths open in shock. "Impossible," Dr. Zolth whispered. "No Aquari has ever survived cardiac arrest after being subjected to such violent physical trauma. According to all our medical knowledge, he should be dead, but Glubnos was very much alive." He looked up at Kate with his large round eyes and made soft bubbling sounds that meant thank you in his language. Kate smiled and checked his pulse, which was steady and strong. The alien medical teams loaded all 3 patients into their advanced treatment pods for transport back to the ship. As they prepared to leave, Dr. Thess approached Kate with a confused expression on her reptilian face. "Dr. Morrison, I do not understand what happened here today," she said. "Your techniques violated every safety protocol we have established over thousands of years of medical practice. Yet all 3 patients are alive and stable when they should have died from their injuries." Kate cleaned her medical kit and packed it back into her bag. Her clothes were dirty and torn and she was exhausted, but she felt satisfied that she had done her job correctly. "Sometimes saving lives is more important than following rules," Kate replied. "We can worry about the proper procedures after everyone is safe." Dr. Thys watched Kate walk toward the shuttle and wondered if humans had discovered something about medicine that all the other races had missed. The idea seemed impossible, but the evidence was lying in 3 treatment pods breathing normally when they should have been dead, as the shuttles returned to the new horizon. Kate looked out the window at the asteroid field and thought about what had just happened. She knew she would probably face serious charges for violating alien medical protocols, but she had no regrets about her actions. 3 beings were alive because she had followed her human instincts instead of alien rules, and that was all that mattered to her. 3 days after the mining accident, Kate Morrison sat in the formal inquiry room facing a panel of alien medical authorities. Commander Vextar sat at the center table with Dr. Thys on his right and Dr. Zolth on his left. Behind them sat representatives from each alien race who would decide if Kate had committed crimes against interspecies medical law. Jake Patterson sat beside Kate as her witness and support. Both humans wore their best uniforms, but Kate could see the suspicion and confusion in the aliens' eyes as they looked at her. She had saved 3 lives, but the alien authorities seemed more concerned about the rules she had broken than the people she had helped. "Dr. Morrison," Commander Vextar began reading from his official tablet, "you are charged with 17 violations of established medical protocols, including unauthorized patient contact, contamination of injury sites, use of non-approved medical devices, and performing procedures without proper certification." Kate listened to the long list of charges and wondered how saving lives could be considered criminal behavior. She looked around the room at the alien faces and realized that they genuinely believed she had done something wrong and dangerous. "Before we proceed with the formal charges," Dr. Thys said, "we would like you to explain your actions during the emergency. Help us understand why you chose to ignore established safety procedures." Kate stood up and faced the panel. She had spent 3 days thinking about how to explain human medical philosophy to beings who had never experienced it themselves. "In human medicine," Kate began, "our first rule is to preserve life by any means necessary. When someone is dying, we act immediately using whatever tools and methods are available. We believe that trying to save a life and failing is better than not trying at all." Dr. Zolth made bubbling sounds that indicated confusion. "But how can you justify contaminating patients with your body fluids and bacteria? The risk of infection from direct contact is enormous." Kate nodded and pulled out her human medical kit. "May I demonstrate some basic human first aid techniques so you can see how they work?" The panel agreed, and Kate called Jake forward to act as a volunteer patient. She showed the aliens how to check for a pulse by placing fingers on the neck and wrist. The alien doctors were amazed that humans could detect heartbeats through touch alone. "We use direct contact because our hands can feel things that scanners might miss," Kate explained as she demonstrated checking Jake's breathing and pupil response. "Touch gives us immediate information about temperature, pulse strength, and muscle tension." Dr. Thys watched carefully as Kate showed how to apply direct pressure to stop bleeding. But what about the contamination risk? How do you prevent disease transmission? Kate pulled out a pair of latex gloves and put them on. We use barriers when possible, but in emergency situations we accept the small risk of infection to prevent the much larger risk of death from blood loss. She demonstrated how to make a tourniquet from a belt and showed the aliens how human first aid used simple materials that were always available. The alien doctors were surprised to learn that effective medical care did not require advanced technology. This is very different from our methods, Dr. Vorth said as he examined the improvised medical devices. We depend on specialized equipment and computer guidance for all medical decisions. The idea of making treatment choices without consulting databases seems very dangerous. Kate asked the panel to bring in Ryan Blake, who was recovering well from his leg injury. Ryan walked into the room on crutches and sat down to answer questions about his treatment. Did Dr. Morrison's direct contact cause you any pain or additional injury? Commander Vextar asked. Ryan shook his head. She saved my life. I was bleeding badly and getting weak when she applied pressure to the wound. Her touch was gentle but firm, and it stopped the bleeding immediately. The panel also interviewed Zekth through a translation computer. The Krithik worker explained that Kate's pressure bandage had controlled his bleeding better than any technology he had seen in 20 years of dangerous mining work. But the most powerful testimony came from Gloob, who had to wear a special breathing device to speak in the dry air of the hearing room. The Aquari spoke slowly but clearly about his experience. I remember dying, Glubno said in his bubbling voice. My heart stopped and I felt myself going away. Then Dr. Morrison brought me back with her hands and her breath. According to our medical knowledge, this should be impossible, but I am here talking to you because she refused to let me die. Dr. Zolth looked uncomfortable as he listened to his fellow Aquari describe the chest compressions that had saved his life. The pressure applied to your chest should have caused severe internal damage. How do you explain your complete recovery? Glubnos looked directly at the panel. I think human medicine understands something about healing that we have forgotten. They are willing to take risks and use their bodies as tools to help others. We have become so afraid of making mistakes that we sometimes choose safety over saving lives. Kate was surprised to hear an alien defending human medical methods. She had expected all the aliens to support their traditional approaches without question. The hearing continued for 6 hours as the panel questioned Kate about every aspect of human first aid. They wanted to understand how humans could make quick decisions without computer assistance, and why they were willing to touch patients with their bare hands. The most difficult concept for us to accept, Dr. Thys finally admitted, is that you acted without authorization from proper authorities. In our cultures, medical decisions are made by committees and specialists. The idea of one individual taking responsibility for life and death choices seems very dangerous. Kate looked at each member of the panel and spoke from her heart. In emergencies, there is no time for committees and specialists. When someone is dying, you have seconds or minutes to act. Human first aid trains us to make those quick decisions because we know that any action is better than no action when time is running out. The panel dismissed Kate and Jake while they discussed the evidence in private. Kate walked back to her quarters wondering if she would be expelled from the ship or even sent to an alien prison for violating their medical laws. But as she walked through the corridors, several alien crew members stopped her to express their gratitude. Word had spread throughout the ship about how human medical techniques had saved 3 lives that alien medicine could not have rescued in time. Kate realized that regardless of what the formal panel decided, she had already changed how the aliens thought about emergency medicine and the value of immediate human action. Kate Morrison waited in her quarters for 2 days before Commander Vextar called her back to the inquiry room. When she entered, she was surprised to see that the formal panel had been replaced by a much larger group of alien medical officers from ships throughout the sector. Word of the human first aid techniques had spread quickly through the alien fleet. Dr. Thys stood up as Kate entered the room. Her reptilian features showed an expression that Kate had learned meant respect among the Zephyrian people. Dr. Morrison, Dr. Thys began, after extensive analysis of the medical data from the mining accident, we have reached some remarkable conclusions. The speed of your intervention was the single most important factor in saving all 3 lives. Kate felt relief wash over her as she realized the charges against her were being dropped. But Dr. Thys continued with information that surprised everyone in the room. Our medical computers have run thousands of simulations using our standard emergency procedures. In every simulation, the patients died before our specialist teams could arrive and begin treatment. Even with our most advanced technology, we could not have saved them without the time you bought with immediate first aid. Commander Vextar activated a large display screen that showed medical charts and data. The analysis proves that human first aid techniques, while primitive by our standards, are remarkably effective at preserving life during the critical first minutes of an emergency. Dr. Zolth made soft bubbling sounds as he spoke. We have discovered that our medical systems have a fundamental weakness. We have become so dependent on technology and procedures that we have lost the ability to act quickly when lives are at stake. Kate looked around the room at the alien faces and saw something she had never expected to see. They were looking at her with admiration and respect instead of suspicion and fear. The Zephyrian Alliance Council has made an unprecedented decision, Commander Vextar announced. We are formally requesting that human medical officers be assigned to all interspecies vessels, not as backup doctors, but as primary emergency response specialists. Dr. Thiss nodded agreement. We want to learn your techniques and incorporate them into our own medical training. Will you help us develop new protocols that combine alien technology with human first aid methods? Kate felt overwhelmed by the sudden change in attitude. Just days ago, she had been facing criminal charges, and now the aliens were asking her to teach them human medicine. I would be honored to help, Kate replied. But you need to understand that human first aid requires more than just learning techniques. It requires changing how you think about medical emergencies. Over the following weeks, Kate established the first interspecies first aid training program aboard the New Horizon. The classes were awkward at first as alien crew members struggled with concepts that seemed natural to humans. Kate watched. Dr. Thiss practiced chest compressions on a training dummy and saw her hesitation about applying enough pressure. You need to push harder, Kate instructed. Broken ribs heal, but dead patients do not. The Zephyrian doctor increased the pressure, but her movements were still too slow and careful. Kate realized that the aliens had been trained for thousands of years to avoid risks and sudden actions. Teaching them to act quickly and decisively would take time. Jake Patterson helped by demonstrating how human teams worked together during emergencies. He showed the aliens how paramedics communicated with few words and anticipated each other's actions. The alien students were amazed by the efficiency of human teamwork. In our cultures, Dr. Vorth explained during one training session, medical procedures require consultation and approval from multiple specialists. How do humans coordinate care without formal communication protocols? Kate smiled as she watched Zekth practice bandaging techniques with his remaining 3 arms. The Krithak worker had volunteered to help train others and was surprisingly good at teaching basic first aid. Humans learn to trust each other's training and judgment, Kate replied. In emergencies, we focus on saving lives first and worry about proper procedures later. The most surprising student was Glubnos, who attended every class despite his recent injuries. The Aquari had become fascinated by human medicine and asked detailed questions about every technique. I want to understand how you decided to perform chest compressions on me, Glubnos asked one day. You had no computer guidance and no consultation with specialists. How did you know it would work? Kate thought carefully about her answer. I did not know it would work, but I knew that doing nothing would definitely not work. Sometimes in medicine you have to try something that might fail rather than do nothing and accept failure. The training program expanded as word spread to other ships in the fleet. Alien medical officers requested transfers to the New Horizon so they could learn human first aid techniques. Kate found herself teaching classes to beings from 6 different races. 6 months after the mining accident, Kate received her most challenging test. The ship's alarm sounded and she ran to the engineering section where a power coupling had exploded. She found Krithak engineer Zixtal unconscious with severe burns on his exoskeleton, but this time Kate was not alone. Dr. Thiss and 3 other alien crew members immediately began applying the first aid techniques they had learned in Kate's classes. They worked quickly and efficiently to stabilize Zixtal without waiting for specialized equipment or authorization from committees. Kate watched with pride as Dr. Thiss applied direct pressure to control bleeding while Glubnos checked Zixtal's breathing and pulse. The aliens had learned to act with human speed and decisiveness while still using their advanced medical knowledge. When the specialized medical teams Arrived, they found Zixtal stable and ready for transport to the medical bay. The alien doctors were amazed to see their colleagues using direct contact techniques that had been forbidden just months earlier. The New Horizons medical bay now displayed a plaque that read, "Advanced medicine begins with willing hands and the courage to use them," Kate had suggested the words after. Realizing that the most sophisticated medical equipment was sometimes knowing when to act like a human. As Kate walked through the ship, she could see the changes her training had created. Alien and human crew members worked together using both advanced technology and basic first aid techniques. The ship had become a model for how different species could learn from each other and create something better than either could achieve alone. Kate received a message from Earth informing her that Starfleet Medical wanted her to develop first aid training programs for all human space missions, but she decided to stay aboard the New Horizon, where she could continue teaching aliens that sometimes the best medicine was the simplest medicine. The ship continued its mission of exploration and research, but now carried something more valuable than scientific equipment. It carried the knowledge that when beings from different worlds worked together and learned from each other, they could save lives that would otherwise be lost to rigid thinking and fear of change.